At CommonWell, we collaborate with health IT vendors to make patient health information accessible across facilities and care settings, regardless of geography, software, or provider. Our services are embedded directly into providers' current EHRs, so your workflow stays the same, but records from other providers your patients have visited are right at your fingertips. Let's take a look at how it works. Meet Jessica. Last year, Jessica got married and moved from her hometown of Asheville, North Carolina, to Aurora, Colorado. Jessica is relatively healthy, but does have a few chronic conditions for which she regularly visits her doctor. And recently, Jessica found out she's expecting her first child. Moving across the country and having both new and old medical conditions to oversee would normally make dealing with Jessica's health records a real challenge for her care providers. But with CommonWell, obtaining all of Jessica's health information is easy. We're going to walk you through the story of Jessica and how the CommonWell services provide value as she traverses the healthcare system across different care settings and geographies. Shortly after arriving in Colorado, Jessica begins feeling fatigued, so she schedules an appointment with Dr. Chris Benson at Lake Family Care in Aurora. Riley, the front desk person, informs Jessica that Dr. Benson is now using CommonWell services to connect and securely share patient information with other locations. Riley validates Jessica's information and asks Jessica to verify the locations she's previously visited so that they can enroll her and share and receive information from her other care providers. With Jessica's acknowledgement of all but one of the listed locations, Riley deselects the one unknown location and submits Jessica's enrollment. She lets Jessica know that those locations will now also have access to the information from her visit today. If Jessica sees any new doctors using CommonWell services in the future, she may be asked to verify locations, but will not need to enroll again. And if Jessica decides she doesn't want to continue to be enrolled, at a future visit she can be unenrolled with the click of a mouse. Now that Jessica is enrolled in CommonWell, when Dr. Benson opens Jessica's records, he receives a notification that there are documents available from her previous doctor in North Carolina. Dr. Benson can now see that Jessica has been previously diagnosed with hypothyroidism. After reviewing recent lab work for Jessica, Dr. Benson is happy to see that her thyroid levels are consistent year over year and in line with where they should be, so there's no cause for concern. Instead, in reviewing her urinalysis taken that day, he has good news. Jessica's fatigue is most likely due to her being 4 weeks pregnant. He refers her to Dr. Aiden Wells, a local OBGYN. Dr. Aiden Wells has been practicing obstetrics for more than 20 years. While she loves her job, one of the challenges she faces is that she treats many new patients. Additionally, a patient's past medical history can have a large impact on a mother, even if it's not something they're experiencing now. When Jessica arrives at Dr. Wells' office, they note that she's already enrolled in CommonWell and see that she recently visited Lake Family Care. They also confirm that she recently visited a local pharmacy and quickly link it to her record. As Dr. Wells reviews Jessica's medical history, she sees that there are documents available from 3 of her past doctors. In addition to her hypothyroidism, Dr. Wells notes that Jessica also has been treated previously for hypertension and GERD, and is taking medication for both. Although these are considered safe while pregnant, there are some small risks. Dr. Wells discusses this with Jessica, and they decide to stop the medication for her GERD, as well as another allergy medicine for now. Over the next 8 months, Dr. Wells adds ultrasound pictures, heartbeat captures, and pregnancy measurements to Jessica's records, all of which will be available in the future to Jessica's other care providers through CommonWell. After 9 months, baby Emma is finally ready to join the family. But Jessica and her husband are nervous because Dr. Wells is on vacation, so a laborist OBGYN, Dr. Devin Cooper, will be handling the delivery. In addition, during the last month of her pregnancy, Jessica began to have issues with her hypertension, placing her and the baby at higher risk. When Dr. Cooper opens Jessica's file, he's able to quickly review her previous visits to the OBGYN and reassure Jessica that he'll be keeping a close eye on her blood pressure. Fortunately, Jessica has a smooth delivery, and soon Jessica and her husband are on their way home with a healthy baby girl. 7 weeks later, Jessica and Jason brave the holiday travel and take baby Emma back to North Carolina to celebrate the holidays with Jessica's family. Unfortunately, while there, Jessica comes down with an upset stomach, heartburn, and other uncomfortable symptoms, and decides she needs to visit the local community ER. Using CommonWell services, the ED doctor, Dr. Aubrey Hayes, quickly sees that Jessica has a history of GERD and that she stopped taking her protonics during her pregnancy. He treats her on site, gives her some medicine, and recommends that Jessica visit her PCP to explore getting back on protonics when she returns to Colorado. He saves his recommendations to her chart, so the information will be readily available to Dr. Benson back in Colorado. CommonWell gives providers easy and secure access to patients' medical history so that you can provide the best care possible. The CommonWell network is growing every day, adding new medical facilities, providers, and patients. CommonWell services are built directly into your existing health IT system, so it's part of your current staff and physician workflows. And it works across EHRs, offices, and geographies, so you don't have to worry about what system another doctor or location is using. With just one enrollment, one time, patients can enable providers to access records nationwide. So snowbirds, college students, travelers, and people like Jessica can keep their records connected wherever life takes them.